Hi, I'm Dr. Kathy Kim, and I'm a body function specialist. In my functional medicine practice, I help you understand how our modern lifestyle is causing structural imbalances and metabolic inflammation that sabotage our well-being. In my last video, I explained how modern chair sitting accelerates stiffening of our thigh muscles and demonstrated how we could promote elasticity by making just a few key changes in the mechanics of how we sit. Today, I want to share my perspective on how the mechanics of standing can also contribute to the progressive stiffening of our myofascial system. Different colors of physiotape represent the myofascial forces along the thigh. As the knees bend, the tape reveals the stretching of muscles and fascia. As they straighten, the left knee stops, but the right knee continues to move backwards. This extra flexibility is known as joint laxity or hypermobility and is extremely common, especially in the knees, elbows, and thumbs. Even though the right knee has only mild hypermobility, the tension created by the right knee mechanics is visible in the tape all the way to the muscle attachment at the pelvis. In conventional medical teaching, joint hypermobility is not considered pathological unless you meet criteria for syndromes such as Marfan's or Ehlers-Danlos. But in my body function practice, I have found that even mild joint hypermobility disrupts healthy body mechanics. Via the body's complex fascial network, these misaligned forces can disrupt function beyond the orthopedic realm, including painful or heavy periods, TMJ dysfunction, vertigo, or even digestive and cardiac problems. Yes, these problems could be originating from your legs. Excellent reference books to describe the anatomic and functional layout of fascia in our bodies are Functional Atlas of the Human Fascial System by Dr. Carl Estecco and Anatomy Trains by Thomas Myers. You may also be interested in reading my case-based articles that discuss the clinical application of approaching our fascial network as a single unified organ, TMJ pain and plantar fasciitis, how they may share the same root cause, and could vertigo be a myofascial problem, Part 2. The crucial problem caused by knee hyperextension is that it immediately throws off the balance of the pelvis and torso, forcing the rest of the body to compensate. Let's look at a more dramatic way to illustrate the disruptive power of knee hyperextension using a yoga posture called Warrior One. In Warrior One, the front knee is bent at 90 degrees while the other leg reaches back to open the groin and stretch the hip flexor. When the back knee is straight, the pelvis can remain more level and the torso stays vertical. With knee hyperextension, however, the thigh muscles drag on the pelvis and the pink back muscles activate to keep the trunk upright, resulting in arching of the low back and a slight shift forward. Comparison of the final images makes it easier to see the impact of the thigh on the pelvis and back. Now that we can visualize how knee hyperextension affects the pelvis and the back, let us take a step back and analyze how it affects our daily movement. Here are typical mechanics for standing up and favoring an anteriorly rotated pelvis. The knees push back, the front of the pelvis tips down, and the pink back muscles activate to keep the trunk upright, causing the back to arch, a shape known as lordosis. By softening the knees, the pelvis and torso can find balance over the heels and allow the pink back muscles to relax. If the knee mechanics don't change, fascia adapts to this movement pattern. Lordosis worsens as the disc spaces are compressed over time. Others resort to a posteriorly rotated pelvis for standing. As the knees push back, the back of the pelvis tilts down and the green muscle group shortens. The pink muscles pull the upper back down and back to follow the posterior pelvic tilt. In this sequence of clips, notice the effect of a posterior pelvis rotation on the thoracic spine, shoulders, and head position. Over time, the thoracic spine can end up markedly out of alignment from the lower half of the body. Remember, the muscles and fascia require strength stretch forces to maintain elasticity. But when hypermobile knees substitute for stretch, the muscles lose flexibility because they're only being used for strength. Over time, stiffening of the muscles and fascia dominate, and the joints break down because they cannot compensate anymore. In traditional squatting, our influential thigh and pelvis muscles have to execute strength stretch dynamics multiple times a day. Stretch greater than strength in order to lower, and strength greater than stretch in order to get up. Muscles must handle both stretch and strength duties, leaving little opportunity for knee hypermobility to intervene. The transition to chair culture has replaced this elastic fluid movement of the thigh with a series of short adjustments that exploits our joints, from the ankles to the back and even beyond. For individuals with moderate and severe knee hyperextension, the fascial forces are even greater. Fortunately, we can incorporate the 3 rules of movement from our last video into our standing mechanics and revive dormant elasticity. As you stand up, use your heels to activate more muscles. Don't move your knees. Challenge your thigh muscles to stabilize your knees over your heels. Instead of locking your knees backwards to stabilize yourself, kegel for balance as you get up and remain standing. Thigh mechanics are considered so important that athletic trainers, yoga teachers, and physical therapists emphasize perfect form for squats and warrior poses. Yet right afterwards, everyone, including the instructors, reverts right back to the stiffening patterns of modern living. Take a day to pay attention to your knees, and you will notice that you lock your knees when you sit or stand, push or pull a heavy door, get dressed, wash dishes, or work at your standing desk. Day by day, the tension you generate in your thigh ratchets into your whole body's fascial network, influencing distant anatomy via what I call fascial histodynamics. Thanks to fascial plasticity, changing our movement improves our histodynamic patterns and helps us to restore health. I hope this video helps you see how knee joint hypermobility can affect your mechanics for standing and motivates you to adopt the 3 rules to help promote and preserve fascial elasticity in your body. Please leave any questions or suggestions for future topics in the comment section. As always, thank you for watching.